Hi, I'm Jack Cush, Executive Editor at RheumNow.com, and this is the Week in Review, March 25th, 2016. Interesting news this week from the website. A Phase 3 bridge study from Amgen and UCB, who are partnering on a project to develop um, romosozumab, which is an anti-sclerostin antibody, and its use in patients with osteoporosis. They completed a trial called the Bridge Trial. What's interesting about this trial, it was done in men with osteoporosis, and they showed pretty much the expected results that increases in lumbar BMD that were significant. Moving that product along, maybe we'll see that in the next year. Another report shows that statin use when used chronically actually has been associated with an increase in non-melanoma skin cancer. Um, why is unclear. Certainly, we know that when we use anti-inflammatory drugs, anti-TNF drugs, that we have an increase in non-melanoma skin cancer in patients with RA and other disorders. Maybe inflammation has a protective role against skin cancer, but interesting nonetheless to see that it occurs outside of the RA arena. A recent meta-analysis shows actually that patients who are being studied for rheumatoid arthritis, especially when we're looking at X-ray results, that over time we've seen a decrease in the amount of X-ray progression in RA. This is sort of understandable with more aggressive therapies, but what has been seen is that the rates of X-ray progression have gotten very, very low. And more importantly, if you compare those before the biologic era and after the biologic era, in fact, it's been cut in half. Such that rates of X-ray progression in RA right now are really very, very low, which will make it very difficult to design clinical trials that will prove X-ray protection by any particular new product. And lastly, Chugai, a pharmaceutical firm in Japan, has received provisional approval for the use of tocilizumab in patients with scleroderma. As you know, last year was reported at the ACR, the Fascinate trial showing preliminary evidence that tocilizumab may be effective in patients with scleroderma. And there is a large trial going on right now that will also look at its results in a much larger study. A few interesting news articles that appeared on the website. One yesterday was on the issue of polypharmacy. A recent report in JAMA looked at the use of both over-the-counter medicines and prescription medicines amongst the elderly and showed that this is increasing significantly so that it actually rose from 84 to 87% all prescription and all drug use in this cohort in two different time eras, around 2005 and again around 2010. So what we saw in this study was not only an increase in overall drug use, an increased use in polypharmacy, and an increase in the number of potential serious drug interactions, suggesting that this is particularly a worrisome finding in the elderly where polypharmacy and drug interactions could be quite dangerous. So there's a bit of caution there. We also reported yesterday on the first head-to-head trial of two TNF inhibitors. Rheumatologists want to see TNF inhibitors studied and want to see head-to-head trials to know what to use and when to use them in the future. I personally am not impressed with how we have used the data, for instance, from ADACTA and AMPLE studies, which have been head-to-head trials that didn't seem to change our behaviors. But nonetheless, this is a first head-to-head trial of certolizumab versus adalimumab using a 3-month endpoint of an ACR 20. They had equal outcomes, roughly around 75% or so. And then a 2-year outcome, those who stayed on the drug were counted as winners, but also really those that stayed in low disease activity, the number was very low. It was around 30 or 35% for both drugs. No significant differences between the two. This year, a new report of a new drug, another new monoclonal antibody against IL-17. This one, ixekizumab from Lilly. Its trade name will be Taltz, and this is based on 3 large trials in psoriasis, moderate to severe plaque psoriasis, where it's been shown in the Uncover 1, 2, and 3 trials that this is a superior drug to placebo. And lastly, there was an interesting report from the CDC. The last MMWR gave an update on the Zika virus, wherein they've identified 116 cases in the last 12 months of the Zika virus in the United States. In South America, it's been rampant. and other countries throughout South America, Central America, and the Caribbean. This is a common infection. It's a virus that is transmitted by the Aedes aegypti mosquito. Gives a lot of features somewhat similar to dengue and chikungunya, but it is self-limiting in most people. It is mild, constitutional symptoms, high fevers, rashes, and arthralgias. What's worrisome about this condition is that if it infects women who are pregnant, that the consequences to the offspring may be quite disastrous, with a number of reports of fetal malformations and especially microcephaly in the offspring. So again, this number has been surprising that it's occurred in the United States. Those that in whom it has affected the United States were those who traveled to endemic areas and came back. It has also been demonstrated this can occur via sexual transmission from someone who traveled to an endemic area. So some caution, especially for pregnant women who may want to travel to the Caribbean, Central America, or South America. That's it for this week on RheumNow. Tune in next week and we'll give you more good news. Take care.